Osteomyelitis. Definition: it is an infection of bone and bone marrow. Etiology: Staph aureus is the most common cause of osteomyelitis. It has a specific receptor which can get attached to type 1 collagen. So special situations. So in sickle cell anemia, Salmonella typhi is the most common cause. In IV drug users and foot puncture wound, Pseudomonas can be a cause. In animal bite, it is Pasteurella, and human bite, it is Echinella. Now coming to the route of infection, it can be hematogenous, it can be direct, and it can spread from adjacent sites like joints, that is septic arthritis. Hematogenous is the most common route of infection, and it can spread from upper respiratory tract, genital tract, or urinary tract. Now the sites of osteomyelitis: the most common bone involved is femur, and the part is metaphysis, as metaphysis has a hair loop pin pattern of blood vessels, and that results in slowing of blood when blood passes through the metaphysis, and thus the bacteria can enter the metaphysis easily, and that can cause infection there. So classification of this osteomyelitis based on time period: it can be acute, subacute, or chronic. Acute when it is duration is less than 2 weeks. Subacute duration is from 2 weeks to 2 months, and chronic when the duration is more than 2 months. The most important part of this discussion is pathophysiology. So you can see that after the entry of a pathogen, there can occur bone destruction and pus formation in the metaphysis. So after the formation of pus, within 24 hours there will be abscess formation. The abscess can either track through the cortex to reach the subperiosteal region. There it forms a subperiosteal abscess, and this abscess pushes the periosteum forward, and that can result in the loss of periosteal blood supply, and thus the death of bone there. And further, the periosteal reaction can occur, that is a simulation of newborn formation, and the newborn formed is called involucrum. And now the pus perforates through the involucrum through an opening called cloaca, and further through the opening through the skin called sinus. Also, the abscess can track into the medullary cavity, and that can result in the loss of endosteal blood supply of the bone, and further death of the bone, and that dead bone is called sequestra, and that can harbor the bacteria and keeps the infection going. Coming to some of the definition: sequestrum is a piece of dead bone inside the abscess cavity that harbors bacteria and that keeps the infection going. Involucrum is a new bone formed as a result of periosteal reaction. Cloaca is the opening in the involucrum through which the pus escapes, and sinus is the opening in the skin through which the pus drains out.